Pancreatic cancer happens when uncontrolled cell growth begins in a part of the pancreas. Tumors develop, and these interfere with the way the pancreas works. Pancreatic cancer often shows no symptoms until the later stages. For this reason, it can be difficult to manage. According to the American Cancer Society, around 3% of all cancers in the United States are pancreatic cancers. In 2018, they expect around 55,440 people to receive a diagnosis of pancreatic cancer. What is pancreatic cancer? Pancreatic cancer affects the pancreas, an organ near the gallbladder that plays a key role in digestion. The pancreas is a 6-inch long organ located behind the stomach in the back of the abdomen, near the gallbladder. It contains glands that create pancreatic juices, hormones, and insulin. Cancer can affect either the endocrine or the exocrine glands in the pancreas. The exocrine glands produce juices, or enzymes, that enter the intestines and help digest fat, proteins, and carbohydrates. These make up most of the pancreas. The endocrine glands are small clusters of cells known as the islets of Langerhans. They release the hormones insulin and glucagon into the bloodstream. There, they manage blood sugar levels. When they are not working properly, the result is often diabetes. The type of cancer and the outlook for each depends on which function the cancer affects. There are 2 different types of pancreatic cancer, depending on whether it affects the exocrine or endocrine functions. They have different risk factors, causes, symptoms, diagnostic tests, treatments, and outlook. Exocrine pancreatic cancer tumors that affect the exocrine functions are the most common type. They can be malignant or benign. Benign tumors or cysts are called cystadenomas. Most pancreatic tumors are malignant, or cancerous. Different types of pancreatic cancers can affect the exocrine functions. Types of tumor include adenocarcinomas, which typically start in gland cells in the ducts of the pancreas, acinar cell carcinoma, which starts in the pancreatic enzyme cells, ampullary cancer, which starts where the bile duct and pancreatic duct meet the duodenum of the small intestine, adenosquamous carcinomas, squamous cell carcinomas, giant cell carcinomas. Endocrine pancreatic cancer tumors that affect the endocrine functions of the pancreas are called neuroendocrine or islet cell tumors. These are fairly uncommon. The name comes from the type of hormone-producing cell where the cancer starts. They include insulinomas, insulin, glucagonomas, glucagon, gastronomas, gastrin, somatostatinomas, somatostatin, VI-pomas, vasoactive intestinal peptide or VIP. Functioning islet cell tumors continue to make hormones. Non-functioning ones do not. Most of these tumors are benign, but non-functioning tumors are more likely to be malignant, islet cell carcinomas. Causes and risk factors. Scientists do not know exactly why uncontrolled cell growth happens in the pancreas, but they have identified some possible risk factors. Genetic factors. Damage or changes in a person's DNA can lead to damage in the genes that control cell division. Hereditary genetic changes pass down through a family. There is evidence that pancreatic cancer can run in families. Other genetic changes happen because of exposure to an environmental trigger, for example, tobacco. A person with certain genetic syndromes is more likely to develop pancreatic cancer. These include hereditary breast and ovarian cancer syndrome, melanoma, pancreatitis, non-polyposis, colorectal cancer, Lynch syndrome. Sex. Pancreatic cancers affect men often than women. This year, the American Cancer Society expect that 29,200 men and 26,240 women will receive a diagnosis of pancreatic cancer. Environmental toxins. Exposure to pesticides can increase the risk of various diseases, and pancreatic cancer may be one of these. Substances that may increase the risk of pancreatic cancer include certain pesticides, dyes, chemicals used in metal refining. When the body comes into contact with a carcinogen, free radicals form. These damage cells and affect their ability to function normally. The result can be cancerous growths. Other medical factors. Age is an important risk factor, especially after the age of 60 years. Scientists have also found a link between cancer of the pancreas and several other diseases. These include cirrhosis or scarring of the liver, infection of the stomach with the ulcer-causing bacteria, Helicobacter pylori H. pylori, diabetes mellitus, chronic pancreatitis, or inflammation of the pancreas, gingivitis or periodontal disease. Lifestyle factors. Some lifestyle factors may increase the risk. Smoking cigarettes or exposure to tobacco smoke, excess weight and a lack of exercise, a diet that is high in red meat and fat and low in fruits and vegetables, long-term, heavy consumption of alcohol, which can lead to chronic pancreatitis, a risk factor for pancreatic cancer. Symptoms often do not appear until the later stages. Abdominal pain can be one of them. Pancreatic cancer is often called a silent disease because symptoms do not show until the later stages. Tumors of the pancreas cancers are usually too small to cause symptoms, and later symptoms are often nonspecific. However, when the cancer grows, there may be pain in the upper abdomen as the tumor pushes against nerves, jaundice, when problems with the bile duct and liver lead to a painless yellowing of the skin and eyes and darkening of the urine, loss of appetite, nausea, and vomiting, significant weight loss and weakness, pale or gray fatty stool. However, a number of other diseases can cause the same symptoms, so a doctor can often not diagnose pancreatic cancer until the later stages. Other possible signs and symptoms include Trousseau's sign, when spontaneous blood clots form in the portal blood vessels, deep veins of the arms and legs, or other superficial veins. Clinical depression, which people sometimes report before a diagnosis. Islet cell or neuroendocrine cancers of the pancreas may cause the pancreas to produce too much insulin or hormones. The person may experience weakness or dizziness, chills, muscle spasms, diarrhea. Pancreatic cancer appears differently, depending on which part of the pancreas the tumor is in, whether the head or the tail. Tumors at the tail end are more likely to result in pain and weight loss. At the other end, head tumors cause fatty stools, weight loss, and jaundice. If the cancer spreads, or metastasizes, new symptoms can occur in the affected area and the rest of the body. If you like more video, just share and subscribe for this channel. Thank you.